following is a Samsung production. It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, as the saying goes, read all about it. Yes, read all about it. January the 2nd, 2007, USA Today, folks, probably the largest distribution of papers in the United States, possibly the world. Headline, Omega-3 pours into cereal, orange juice, eggs, pet food. Okay, one of the biggest announcements probably that we've been talking about in a number of shows here with Dr. Michael Gross, who is the Chief Medical Officer for LifeGuard Health. We have another exciting show for you today. In fact, folks, I have some results. I promise you, I got my blood work right here, and we're going to talk about the omega-3s, okay? I want to welcome on the show today Dr. Philip Benyo. Dr. Philip Benyo is internal medicine, and he specializes in geriatrics, and we're going to learn a lot today. So, folks, if you want to feel good, you have arthritis, high blood pressure, cholesterol, I don't care what's going on in your system, you want to pay attention to this show. Dr. Michael Gross, it's always a pleasure to see you again.
Thank you, Sam, and Happy New Year, and happy, healthy New Year.
Well, I'll tell you, and Phil, it's always nice to see you, too.
You're looking well.
Yes, I am. These fish oils, fantastic. I'm going to talk about, I have my blood work stuff here, and I have Dr. Benyo, explain it. I'm really excited about this. But I want to talk about, we all know today, we know that there's no question about it, fish oil, omega-3s, are good for you. Okay, we know that. Now, this article here, omega-3 pours into cereal, orange juice, eggs, pet food. Everybody in the world is jumping on this. He says your omega-3 is the hot ingredients, and it's become a miracle food. Exactly what I said last show, Mike, about the fact that this is a miracle. This particular omega-3s. Let's talk about the type of omega-3s, because fish oil is not always fish oil. It's fish oil.
Well, Sam, before I answer that, I want to make an appeal to all the listeners and all the viewers at the highest altitude, because certainly we're here to support our products. We're very proud of them. We believe that they're the best that people can buy. But omega-3 essential fatty acids are probably the most important breakthrough in medicine that I've had a chance to see in my career. Dr. Mead, who was on with us last time, mentioned it as well. So whatever people get out of these programs, certainly we want them to get the idea clearly in their head that omega-3 essential fatty acids are critical to good health. Now, what was highlighted in that article, Sam, that you mentioned, the USA Today, was that omega-3s are now being added back into food. So I guess our first question should be, why in the first place were they removed from food? And it had a lot to do with shelf life and preservation and taste and so forth. And unfortunately, what the food industry did in this country was substitute these fats of life with things like trans fats and other saturated fats, which help preserve the foods that they were in but made them less healthy. So what the food industry is discovering now is that we need to put back these essential fatty acids into food so that people can get the essential nutrients that they need. And we're not just talking about any omega-3, we're talking about the two most important omega-3s, which are EPA and DHA, and that is what is not clear in that article.
Okay, explain that to me. Now, you said the two most important ingredients is EPA and DHA. What's EPA?
Eicosapentaenoic acid and docosahexaenoic acid. That'll be the first and last time I say it on this show.
Okay.
Those are two of the three omega-3 essential fatty acids, and these are the only two that we are genetically equipped to utilize in our bodies.
Okay. Now, when you said the article here, and they're talking about cereal, and they're talking about, orange juice, eggs, and I mean, I would think, you have to eat a lot of eggs, okay, drink a lot of juice, even to come close to what we have here with the LifeGuard
That's correct, product. Sam. And what is being added back into the food now is the third omega-3 essential fatty acid, which is alpha-linolenic acid. This is the type that comes from plants, and originally human beings were able to convert that essential fatty acid into EPA and DHA, but now less than 1% is convertible. So the food industry, once again, is not representing accurately. When they add this back into the food, they're saying this is an omega-3 and it's good, but your body cannot utilize it. So most important, folks have to recognize that only EPA and DHA are of importance, are absorbed and able for the body to be utilized. And then we need a certain amount on a daily basis, at least 1 to 2 grams. So if we used your example, Sam, of the egg, there's about 100 milligrams of omega-3 in what's called an omega egg. People would have to eat 10 or 20 eggs a day at that level to get the daily requirements of omega-3 essential fatty acids. So we're talking about a product here that only requires, because of its purity and concentration and potency and absorbability, only 3 or 4 capsules a day, and we've met our daily requirement.
I'm going to tell you, folks, what I want to do right now, because I know as we're doing the show, you're going to want to find out more about the product, okay? It's LifeGuard Health. I happen to use what they call the triple play. And I use Flex, and I use the LDL, and I also use the HDL, of which Dr. Gross and Dr. Benyo will explain. But one thing I found, for some of you who watched the very first show, and you said you're taking fish oil, and fish oil is not all the same. But, you know, I encourage you to, really encourage you to, when you get that fish oil off the shelf, smell it, and then smell this stuff, folks. You're going to know what I'm talking about. You're talking about it's pure, it's pharmaceutical, the best. I cannot stress enough, especially when you see my results of my blood work. I'm a little short, fat guy, but you're going to see my results here. I cannot stress enough to get the triple play, but there's an 800 number, okay, that we have on the screen, and we're going to scroll now some pharmacies and, yes, doctors, okay, who have this product. Getting back to, before I talk to Dr. Philip Benyo, Mike, Dr. Gross, we're talking here about, to me, I said, you know, it's a no-brainer. I mean, I am really excited about this product because I've been using it, and we're going to hear from the good Dr. Benyo here, who has his own television show in northeastern Pennsylvania. You know, I've been watching other products, I've been watching other shows, okay, because we're doing a show here, and first of all, if they're taking fish oil, I think it's a good start. I think it's a great start to start taking fish oil. But there's a major difference, and that's the thing that I think I would like for you to stress. There's a major difference between the LifeGuard omega-3s versus the other product. And I mean, without knocking, and we're not knocking, but give us the reason why, okay? And we know of your background, and we know of Dr. Benyo's background and Dr. Mead's background. You guys are not sitting here because you're lying to people. But tell me why, Mike.
Sam, there's a number of metrics or benchmarks that we should use when we're judging these products. And as you said, all fish oils are not created equal. Certainly we could start with the sniff test. If a product smells like fish, it's usually not a high quality product. So let me start with that. But what people should understand and what makes these products different, first of all, is potency. How much of the omega-3 essential fatty acid is in the fish oil product that people are buying? The over-the-counter products, the things that people buy in discount stores and so forth, have about a 10 or a 20% potency. So 80% of the product is garbage, and it smells like garbage, as opposed to the LifeGuard product, which is 60% EPA and DHA, and we know from our science when we get beyond 60% potency, we actually can run into some concerns of toxicity. So we should get the most out of the amount of fish oil that we're taking in terms of the percentage of omega-3 essential fatty acids per gram of fish oil.
Now let me revisit something here, okay? We're talking about these omega-3s and we're talking about the product. Now let's talk about the symptoms. People out there who have the arthritis, who have the rheumatoid arthritis, who have diabetes. We had a person, Judith, on the first show, talked about her diabetes and how that decreased, and the good doctor's going to tell us some of the results he had with his patients. We talk about high blood pressure, okay? We talk about all the things that your body creates because of inflammation. And basically, this particular product decreases the inflammation, and that's where you start getting all the good results, okay? Now, I'm going to talk to Dr. Philip Benyo. Dr. Philip Benyo, folks, is an internal medicine, and he's also specializes in geriatrics. And first of all, Dr. Benyo, thanks for coming on the show.
It's our pleasure, Sam, as always.
Let's talk about your involvement right now with omega-3s, okay? And tell us, you know, what your feeling is and what results you've had with some of your patients already.
Certainly, Sam. And before I answer that, I would like to give you 2 disclaimers. First of all, patients out there should check with their doctor before starting any of these over-the-counter preparations. And that being said, I need to tell the listening audience that I'm here as a volunteer. I'm not getting dime one from you or omega-3 or LifeGuard or whatever. I'm here because I do things in the public interest, and I believe that this is one of those things in the public interest. Our patients who have started this have noticed immediate, and I mean immediate, within a 7 to 10 day period of time, a decrease in the amount of inflammation in their joints, in their muscles. They actually feel like they have a little bit more lead in their pencil, more get up and go. And it's really remarkable and refreshing to see something that we can give a patient that's not a prescription, that's not high priced, that doesn't have side effects to speak of, and I don't have to monitor their blood chemistries like their liver and kidney function to see if I'm doing any damage to them.
You know, that's the exciting thing about this. Dr. Mead sat there and he said, in 20 years of practice in medicine, omega-3s are the biggest breakthrough since he can remember. And every day, if anyone goes to the website, and you'll see all the information. So you've seen some patients already, okay, because you have the product in your office, okay. You've seen patients in what did they have? Diabetes? What was it?
Well, basically, I'm picking up on the inflammation, the anti-inflammatory properties of the fish oils, because that's an effect we can see immediately. It's going to take time for someone's sugar to normalize or their cholesterol values, and the long-term effects are obviously going to be out there. But I'm impressed by the immediate anti-inflammatory properties. And keep in mind, Sam, that if I tell you to take an over-the-counter anti-inflammatory, I'm actually, in theory, increasing your stroke and heart attack risk. And that's a problem with some of the prescription and anti-inflammatories out there. So here's a product that's going to take care of the inflammation and not put you at a higher risk for a cardiovascular or stroke event.
Say that again. As far as if it would increase, what is that?
In other words, I cannot prescribe all those commonly over-the-counter preparations. Over the long haul, they actually increase side effect and stroke and heart attack risk.
There's a difference between this product, the LifeGuard product, versus any other product, all right?
There's 2 major differences I see, Sam. First of all, they are pharmaceutical grade, and we can't say that for the other over-the-counter fish oils. And secondly, they're blended. I can actually pick a type of problem if you're having an issue with cardiovascular health, if you're having an issue with anti-inflammatory arthritic help, and if you need help with, for example, Alzheimer's or mind issues. There's 3 separate fish oils for each one of those broad categories.
And Flex is primarily for what, Mike?
Well, as Dr. Benyo mentioned, the anti-inflammatory is potentiated in the Flex product. So it has all those cardiovascular benefits in it, as Dr. Benyo mentioned, but it's especially maximized for these arthritic components.
Okay, and the thing interesting here, Dr. Benyo, is that before we did the very first show, I had Dr. Gross told me his feelings about what he feels about wellness. And that's the whole theory and mission of this particular company is wellness, to make people feel good. And I started using the Flex, and also I used the LDL and the HDL, folks, and they call that the triple play. That's what I use. I immediately, within 2 months, 2 weeks, 3 weeks, started feeling a difference getting out of bed. And I said, you know what, I don't know if this is my imagination, but I'm feeling terrific getting out of bed. I don't have those aches and pains. I think I even told you. And he said to me, well, Sam, did you get your blood work done yet? I said, no. He said, well, wait till you get your blood work. Now, folks, announcing, we should have a drum roll here. Now, Phil, you're a doctor here. I have my before and I have my after. You want to just tell people there and just exactly, what, now this is after me taking the LDL, and we're going to explain these 2 other areas why these are so important. But what do you see?
Okay. Well, Sam, last year, April 2006, I did an LDL, which is the bad cholesterol on you. It was 153, not good. We want it less than 100. And so you were kind of in trouble, and we talked about whatever we talked about. And here we took your blood work at the end of the year. This is some 6 months later, and your LDL is under 100. It's 92. And not only that, your liver, kidney, bone function, everything we checked out was completely normal. So that's a drop of what, over 50 points? Which is more than I can expect for any kind of drug I would give you. And again, you don't have that risk of affecting your liver, kidney, or muscle enzymes. And you feel great.
Yeah. Well, that's the exciting part. The whole thing about this thing is saying it's a no-brainer to me because I feel terrific. Now, you could have said to me, or if I would have said, Doc, I'm really nervous about this, you could have put me on a Santin, okay? You could have put me on one of those pills, and then I would have started having some side effects. My back, my legs are hurting me, etc. Most of these side effects. But I went through this process. Let's talk about this LDL, good Dr. Gross, and this HDL. Why are these two things so important? Who should be taking these?
Sam, before I answer that question, I just want to say what a thrill it is to be here with Dr. Benyo and Dr. Mead in the previous show. And Dr. Benyo and Dr. Mead and myself, we came to medicine as healers, and our goal was always to try to help the entire patient in the most comprehensive way as possible. We spend so much of our time treating one symptom at a time, one disease at a time, so it was so great listening to Phil talk about the way that he's helping his patients in general with so many of their needs with one approach. So the triple play that you just mentioned, Sam, this is a comprehensive cholesterol approach. The omegas, besides their anti-inflammatory benefits, attack specifically one component of the cholesterol profile, and that is the triglycerides, which are critical in terms of good blood cholesterol management. The statin drugs, and Phil can help me with this if I'm wrong, they have literally no effect whatsoever on triglycerides, very little, if any. They only deal with the so-called bad or LDL cholesterol. And they do that with the potential for harm. Our LDL product is a natural product. We could call it a natural statin, and we don't have to worry about these dangerous side effects. So combining that with the omega product, we've now got the triglyceride component covered, we've got the bad or cholesterol, the LDL component covered, and our no-flush form of niacin. Niacin therapy has been around for years. One of the oldest tools that doctors have had for cholesterol management has been niacin, but there's been a flushing reaction that's been associated with it, and now we have a no-flush form of niacin that LifeGuard has utilized in its HDL Boost product. So when folks take this triple play approach as you have, Sam, they get more benefit, more comprehensive coverage of their cholesterol profile without the danger of the side effects that they get prescription meds. So from prescription meds. So we're talking about not only a greater benefit, but we're not talking about no harm. And that's why we became doctors.
Folks, if you just tuned in, you're watching the Sam Lesante Show, and what you're seeing right now is the product called LifeGuard for Health. Okay, this is the omega-3s, the purified, the number one fish oil, is, to make it simple. I'm Sam Lesante, and my guest is Dr. Philip Benyo, who is internal medicine specializing in geriatrics, and also the Chief Medical Officer for LifeGuard for Health, Michael Gross, Dr. Gross. You want to find out about the backgrounds of these guys, you'll find out it's as long as 20 pages. They're all been around for a long time, and they're talking about good health. Dr. Benyo would not be sitting here. Dr. Mead, who is president of Orthopedics Associates in Allentown, 23, 24 orthopedic surgeons, has a great facility there, would not be sitting here telling you about this product. We talked about side effects. Some people who've been using the old fish oil, okay, they became discouraged because smell was bad, they were getting aftertaste, etc. I have not yet had one iota of that, okay, particularly when I open this up, folks, and I tell you, do yourself a favor, stop what you're using and buy this stuff, forget this stuff, okay, and then smell this stuff and then smell your stuff, and you'll know why it's so pure. Let's talk about any potential side effects, if there, if there are any, Phil.
I've not really seen anything. I think if you're on medications, you should need to get your medications reviewed. There would be concern if you were on blood thinners, for example. But personally, I've not really run into anyone who's had any side effects of the oils thus far.
Mm-hmm. Mike?
And what I would add to that, and Dr. Benyo makes a great point, because we are correcting an essential imbalance in the body, what happens is that folks who are taking prescription meds find that their medication needs are reduced. So we want them to work with their doctors, because if they're taking a blood pressure medication, if they're taking a diabetes medication, or a statin drug, usually their requirements are lessened, because by putting the body in omega balance, we lessen the need for these prescription meds. Now, that being said, the complaints that people usually have with fish oil relate to burping or gastrointestinal disturbance, and that has to do with the purity of the oil and the form that it's in. Almost 99% of the products that are out there are in an ethyl ester form, which is a chemical form, a cheaper type of product. That's it. It's easier to make. It's not as well absorbed. What LifeGuard does is convert that back into nature's form, which is the natural TG form. It's much more quickly absorbed. It gets to the source, and that's why people don't have the belching and the repeating. And most importantly, it's doing the job. So people need to take less of it to get the job done.
And that brings me to the price of omega-3s, okay? When you're talking about, when you just brought these factors out that, okay, that make it, the cost in the long run is better. Correct, Phil? I mean,
no doubt. And I'd put the question to you, Sam.
Yeah.
Are you going to wear out, or are you going to rust out? And I use that analogy freely, and the reason why is in any place where rust will happen, what do you do to prevent the rust?
You put oil in it.
You use oil.
Right.
You use oil daily on a generous basis, you will get no rust. And I use that analogy for your own body. You're going to wear out without question. I'm willing to bet these oils are going to slow down that process, but you won't rust out.
That's quite interesting, folks. I've been using this product, and if you just tuned in, Dr. Benyo read my results from my last blood work to this blood work. The bad was 153. 6-7 months later, it was 92. But keep this in mind. I started using the fish oil, the omega-3s, probably, I'm talking about 2 months ago, right? We're talking about... So it wasn't a full 6 months. So I'm talking about, I saw results immediately after, 3 or 4 weeks. The Triple Play is the product I use, and believe me, I'll tell you, I would only hope that you get 50% of the results that I've been getting. That's why I'm so excited about this product. We talk about the price, fully justifies it. Let's talk about the condition-specific conditions of omega-3 products, okay? And why this is such a great product.
Sam, I want to go at both of those. So very quickly about the price issue. When folks go into the Sam's Club or the discount store and so forth, they see a big vat of fish oil, 200 capsules, 300 capsules for $10 or something like that, and they think that that's a bargain.
Yes.
Unfortunately, it would take 30 or 40, 50 or 60 of those capsules a day to reach the thresholds that are required for therapeutic results. And it's no bargain. So the folks out there who are watching should understand that even though you're getting a lot for what seems like a little money, if you took what you needed on a daily basis, you would run out of that in 2 or 3 days. So LifeGuard's product, because it's so potent and so absorbable, it is a bargain. It costs significantly less money to get your daily amount per day using the LifeGuard product. And what makes it even more special, as Phil said earlier, if you have a specific need, if you have an arthritic problem, a cardiovascular problem, a blood pressure problem, if we're worried about Alzheimer's disease or dementia, we start with one of these condition-specific omegas, which are unique to LifeGuard, and we can attack this not in a one-size-fits-all manner, but in a condition-specific manner, just like we would attack any other disease process as physicians.
Dr. Benyo, you specialize in geriatrics, okay, and we're talking about this product. Last time we addressed the product as who should use the product, what are the ages, okay, and Mead's response was 2 plus whatever, okay. How are your feelings on that?
I think if your heart's beating and your lungs are breathing, you really need this product. And I wore this tie specifically, Sam. If you could hone in on this.
Just lift it up a little bit.
You could see a black sheep. Now, why would I wear a tie like this?
Hold that up. We're going to show Is that me by any chance?
It could have been. And the reason why is we know those patients are out there. They're on a laundry list of medications.
Yeah.
They're not getting the goals that they are looking for on these medications. They're probably getting side effects from the medications, and they feel like black sheep. They keep complaining to their doctor, and their doctor throws up their hands, whatever. And here we're offering a product that has the chance of lowering their risk factors for cardiovascular events, inflammatory processes. They're going to feel better, less side effects, with the hopes of even cutting down on this laundry list of medications. So they won't feel like that black sheep anymore.
Dr. Benyo, let me ask you a question, a personal question. How many years have you been practicing medicine?
I graduated from Hershey in 1979.
Okay, so you've been around a little bit.
Yes.
Okay, folks, if you just tuned in, Dr. Benyo made a statement before. He is not getting paid 1 cent to say what he's saying. Okay, and he has a reputation that's second to none as a medical profession. And that's the exciting thing about what we find. Dr. Mead, who is one of the top orthopedic surgeons in the country. Dr. Michael Gross, who is a major head of the high risk, right, OBGYN in the Philadelphia area. You lectured, you wrote books, you did a lot of things talking about welfare or wellness for people. It's exciting, okay? I want to repeat that I use the triple play, okay? And that's the thing that I think you should really check into, if anything, okay? You know, he talked about Alzheimer's, and this is interesting. Dr. Mead touched a little bit about this, and you touched a little bit about it too, as well as Dr. Benyo. When it says mind, what does this mean? Everyone's, particularly if you're in the 60s, 50s, early 70s, or for that matter, if you're in good health and you're in 80, okay? What is the mind? What does this have, okay? And what does it do to help prevent or decrease Alzheimer's?
Sam, when we think of these essential fatty acids, the two that I mentioned earlier, EPA and DHA. EPA is the anti-inflammatory component of the essential fatty acids, and DHA is brain food. So what happens is, as Phil just made a great picture of what it would be like running your body, or running an engine without motor oil. Imagine what it would be like running your brain without the essential nutrients that it needs in your body, without the brain food, without the essential oils that we need to keep our joints and all of our organ systems functioning. Well, we've learned now that dementia and Alzheimer's disease is a function of inflammation and a lack of DHA. So our Omega Mind product is formulated for folks who have that concern, and there are many studies now that show that high doses of products like ours, our Omega Mind product, can even help arrest or reverse the decrease in cognitive function that we all think is part of aging.
Folks, call that number now, 888-820-LIFE, or visit the pharmacies or the doctors that have been listed there. Dr. Gross, thank you once again. Dr. Benyo, is a pleasure. It's Your Health is the name of his show in northeastern Pennsylvania. Website, ssptv.com. ssptv.com. This show is archived, so if you have any friends in the United States or in the world would like to learn about this, tell them to go to our website. Thanks for joining us, and we'll see you again.
This has been a Samsung production.